And you mentioned that nattokinase and
Lumbrokinase.
yes, can eat up spike protein. Are there other supplements that can do this?
Yeah, so nattokinase has been around for a long time. It's like I said, natto is used as a food in Japan. It's a fermented soybean, and nattokinase is the enzyme that comes out of that. So it's kind of a food grade dietary supplement that people use for a lot of different reasons. It does break up fibrin, and fibrin clotting and fibrinogen can lower inflammation. It can eat up the spike protein. It must be taken on an empty stomach. You don't want to have any kind of proteins in your stomach because the enzyme will be used up digesting those instead of getting in your bloodstream. If you have a sensitivity to soy, it's probably not a good idea to use nattokinase. So lumbrokinase, which comes out of the earthworms, has been used in Chinese medicine for over probably 3,000 or 4,000 years. It is another enzyme that has similar properties. I particularly like it because it has a brake pedal. So if you take too much of these enzymes, it can cause you to bruise or bleed, with the exception of lumbrokinase, which will actually stop degrading fibrin once the proper level is reached. And actually, if your fibrin is too low, it can actually build up fibrin to normal levels. Another enzyme is serrapeptase. That's another thing that can be used to help with clotting, microclots, and eating spike. Eliquis is a drug that is used to thin blood. I'm not sure what effect it has on the spike protein, if any. Aspirin, again, stops the clotting cascade by working on inactivating platelets that want to aggregate, and is one of a few drugs that is a fasting mimetic. So I don't know if you heard me say that fasting or intermittent fasting is one way to turn on autophagy, which helps clean up the inside of cells, and mitophagy, the inside of mitochondria, so that there's no need to have cell death or apoptosis. And that's what you want. You want the cells to clean themselves up, get rid of that spike protein. And that's what intermittent fasting can do. And if somebody can't do it, you can use fasting mimetics like aspirin, metformin, rapamycin, and transresveratrol, quercetin. Those are all things that kind of turn on autophagy and allow the cells to kind of clean themselves up. So those are things that are helpful in fighting long COVID.
Dr. Kent Holtoff just added bromelain as well.
Right. So bromelain is an extract from pineapples, and in Peter McCulley's recently published piece on agents used to help with spike, I think it was published in the AAPS journal maybe last month. He mentions the use of bromelain as another agent. So yes, that's one that some people use for digestive issues, and apparently it has some anti-spike properties, as what appears in some published literature.